Hello everyone, this is Dr. Neelam here. Today I have come up with the important CD signs to be able to recognize while working in an emergency room. So first and the most important uh, common presentation to emergency room is a stroke in a window period. So what are the signs we'll be able to recognize in a CT scan? First is the hyperdense MCA sign. It is basically seen acutely and it develops basically within 90 minutes of the event. So it is seen in a non-contrast CT scan in an acute phase. It basically refers to the MCA occlusion, that is middle cerebral artery occlusion. So it is associated with a large MCA territory infarct. This sign is highly specific. The other signs which we see in an acute stroke is next is the insular ribbon sign. It is basically the absence of the thin high attenuation zone of the normal cortex which is present medial to the sylvian fissure. This sign is also seen in an acute phase. And next sign which we can see in a plain CT scan is the dot sign. It is basically a variation of the hyperdense MCA sign itself. Uh, it is due to the occlusion of the distal branches of the MCA, that is the middle cerebral artery, and it is seen in the axial section as the occluded vessel. It courses in a plane perpendicular to the transverse plane of the imaging. So if this sign is identified and if we intervene early in this case, it has a good outcome basically. And the next sign which we see in an acute stroke is the disappearing basal ganglia sign or a blurred basal ganglia sign. It is basically seen in an acute infarction. It is due to the loss of the delineation of the basal ganglia due to the blurring of the gray-white matter interface. So it is best appreciated when we see it in comparison to the contralateral side. It is caused by the occlusion of middle cerebral artery. This is the earliest sign and most frequently seen in an acute infarct. And coming to the next important presentation to emergency, that is our cortical venous sinus thrombosis. So what are the signs we generally see? First is the empty delta sign. It is seen in a contrast enhanced CT scan. It suggests a dural sinus venous sinus thrombosis. It is seen in 25 to 30% cases basically. It may not be seen in the early phases, less than 5 days, or more than 2 months in the later phase, that is more than 2 months. The other signs which we see in a CVST is our triangle sign and a cord sign. These two are seen in a non-contrast CT scan. It also represents basically clotted blood within the superior sagittal sinus, and which is seen as an hyperdense area compared to the cortical brain matter outside. And coming to the last sign which I am going to highlight today is the reversal sign. It basically represents an ischemic brain injury which is irreversible, and if seen in a patient, it indicates a poor prognosis basically. It basically refers to a diffuse decrease in the density of the cerebral hemisphere uh, with relative increase in the density of the thalami brainstem and the cerebellum. It is also known by a term as white cerebellum. It is generally seen in cases like severe head injury, drowning, bacterial meningitis, and encephalitis and birth asphyxia. Thank you. Hope this will be useful for you.